Ankylosing spondylitis doesn't just steal your spine. It steals your posture, your mobility, and your freedom. If you act early, you can prevent this. Hi, I'm Dr. Vikramraj Jain, consultant rheumatologist practicing at Bangalore. And in this video, we'll talk about the diagnosis of ankylosing spondylitis. How is ankylosing spondylitis diagnosed? The diagnosis of ankylosing spondylitis in a patient with inflammatory back pain depends on certain imaging techniques like X-ray or MRI to show inflammation in the sacroiliac and the spinal joints. Along with this, we also advise certain tests called ESR and CRP to look for inflammation, as well as a special test called as HLA-B27. This is a gene which is present in 90% of patients of ankylosing spondylitis. So, to make a diagnosis in a suspected patient of inflammatory back pain, we do certain imaging as well as blood tests, and using all of them put together, we make a diagnosis of ankylosing spondylitis. Coming to treatment of ankylosing spondylitis. The treatment of ankylosing spondylitis can be put under two categories. One is medication and exercise. So medications, the first line medication which is suggested is NSAIDs or painkillers. These not only reduce the pain but also reduce the inflammation in the joints and prevent progression of the disease. The next medication are DMARDs or disease modifying antirheumatic drugs, which are used especially in the joints apart from the spine. The third and most important category of medication is called as biologics, with medications like etanercept, adalimumab, infliximab, secukinumab, which are useful in treatment of ankylosing spondylitis. A newer group of therapy called as targeted synthetic DMARDs or JAK inhibitors, example tofacitinib, is now found to be useful in patients with ankylosing spondylitis. Steroids are used rarely in ankylosing spondylitis, especially for the peripheral joints in terms of injections or oral tablets for short term. The second and important component of treatment of ankylosing spondylitis is exercise. AS is a very unique disease where rest worsens but activity improves your stiffness. So exercises like stretches, chest expansion exercises, physiotherapy, core body strengthening exercises, and certain activities like swimming and brisk walking helps. Apart from exercises, lifestyle changes like stopping smoking and using a firm mattress, maintaining your weight also helps. Medications control the inflammation and prevent spinal fusion. Exercises keep you functional. Together, they help to preserve your spine as well as your quality of life. If you found this video useful, please like, share, and subscribe. Thank you.